pleasure to be here. Wait, we were hanging out.
Good morning. I'm Elizabeth Landsberg, the Director of HCI, the California Department of Healthcare Access and Information. Our vision is equitable, quality, affordable healthcare for all Californians, and I'm honored to be here today to announce the launch of the Golden State START program to address the crisis of affordability by providing 400 free diapers for California newborns. I want to thank Governor Newsom, of course, and Secretary Johnson for their leadership and our partners at Baby2Baby. At HCI, the Department of Healthcare Access and Information, our role is to take big ideas like this and make them real in the world. Golden State START is exactly that kind of effort. We know the cost of diapers is a huge burden on families, it causes mental health stress for families. We want babies to be clean and safe and healthy. So we know that given that the cost of diapers is a burden, we're here with a program to make it as easy as possible for them to get free diapers. So we built Golden State START to be automatic and universal. We are not going to have families fill out an application, make it complicated. Families will get 400 diapers upon discharge. They don't have to sign up or navigate a new system. They simply receive support when they leave the hospital with their newborn. Our selected partner, Baby2Baby, will work with hospitals delivering diapers to them, and the hospitals in turn provide them to families at discharge. So by using hospitals as the distribution point, we are able to reach families at the moment when they need the diapers the most. We're prioritizing hospitals that serve large numbers of Medi-Cal families so that we can get it to the families most in need, and from there we will expand. But even in its first year, this is a large-scale program distributing millions of diapers. Success means that hospitals can easily participate, distribution is reliable and consistent, and families receive diapers without barriers. So we're here to make affordability real. At HCI, we also have the Office of Healthcare Affordability, the CalRx program, bringing insulin to Californians, and we're proud to deliver programs making a real difference in families' lives. And we are ready to get to work today and get those diapers out to babies. With that, I'm pleased to turn it over to Mayor Daniel Lurie.
Thank you all. Governor, welcome back to San Francisco, to your favorite Children's Creativity Museum. I know you love this place as much as I do, and I appreciated you throwing the diapers at me backstage. We are thrilled and excited that the state of California, under your leadership, Governor, is investing in our families, because there is no better investment we can make than in our young people. Earlier this year in San Francisco, we launched the Family Opportunity Agenda, a citywide effort to bring down the cost of living and expand economic mobility so families can stay in San Francisco. Under this agenda, San Francisco is going to be the first city in the country where every family with a young child has access to childcare. This work also includes efforts to close the maternal and infant health disparities, support children with disabilities, and make room for more housing so more families can afford to stay in the neighborhoods that they love. Surrounding families with the right support from the very beginning can change the future of a child's life and the future of our city and our state. Today, Governor Newsom is building on that same commitment with a statewide investment that will help new parents across California. His leadership recognizes something we know here in San Francisco. When we reduce pressures families face in those earliest moments, we create stronger foundations for children, parents, and communities. Together, these efforts send a message that California is committed to being a place where families can afford to live, grow, and thrive. Thank you, Governor, for your leadership, and thank you for making sure California's future is bright. And now I'd like to welcome up Assemblymember Liz Ortega.
Buenos dias, good morning. What a beautiful day it is for babies in diapers. I'm Assemblymember Liz Ortega, proudly representing District 20 across the Bay. I want to first thank our governor, our mayor, and baby-to-baby and diaper banks across the state. In 2023, nearly 1 in 2 families with babies and toddlers cannot afford to buy enough diapers to ensure that their child stays clean and healthy. I decided to lead on this issue in the state legislature because it was much bigger than just diapers. It's about a story. It's about the stories of everyday Californians who are struggling to make ends meet. I was once a young mother who ended up a single mother at the age of 21. I remember working full-time, going to school, and really struggling with my finances, having to make difficult choices about food, gas, bills, and diapers. Today, many of us families are struggling with that same story. I don't want any other family in the state of California, the 4th largest economy in the world, to have to make those difficult choices of whether to put food on the table, gas in their tanks, or keep their babies happy and healthy with a clean diaper. So this issue is more than just diapers. It's a public health and an affordability issue, which is why I'm so excited and proud to be here with our governor, who is leading the nation on this issue. I want to say thanks again to everyone here, and cheers to all the happy and healthy babies that we will now see across the Golden State. Thank you. With that, I would like to introduce Kelly and Nora, from co-CEOs of Baby-to-Baby.
Hi, everyone. I'm Nora Weinstein, and this is Kelly Sawyer-Patricoff, and we're the co-CEOs of Baby-to-Baby, a national nonprofit headquartered in California. We have distributed 500 million basic essentials, including diapers, clothing, food, and formula, to children in need across the country. Diapers have been at the core of our mission for 15 years, as a startling 1 in 2 families in this country cannot afford them. Today, we are so immensely proud, especially as we head into Mother's Day weekend, to announce Golden State Start, a first-in-the-nation program where we will have the honor of providing hundreds of free diapers to every newborn delivered at a hospital in the state of California.
We serve hardworking parents every day who are forced to make impossible decisions, like whether to buy diapers for their babies or put food on the table. For low-income families, diapers are the 4th highest expenditure after rent, food, and utilities. In response to this, Baby-to-Baby built our own diaper manufacturing system, which allows us to produce diapers for 80% less than the retail price and distribute 5 times more. We've given out over 300 million diapers to date, and we look forward to using our manufacturing and distribution model to combat diaper need together with the state of California.
This is not the first time we've had the opportunity to work alongside Governor Newsom and the First Partner as they have championed babies and their most basic needs. As parents of 4 children, they have changed their fair share of diapers. In 2020, because of the empathy, leadership, and support of Governor Newsom, Baby-to-Baby successfully advocated to remove the sales tax from diapers in California. This historic decision paved the way for 13 states to follow suit. And today, with Golden State Start, California is once again setting the standard for what it means to show up for mothers and babies.
The Golden State Start program will provide 400 baby-to-baby diapers to all new parents at no cost to the family. Baby-to-Baby will manage diaper procurement, warehousing, and hospital distribution of this essential program on behalf of the state of California through the Department of Healthcare Access and Information, leveraging our deep experience serving families across the country and throughout California. We are so grateful to our extraordinary baby-to-baby team for their tireless work and care to bring this program to life.
Thank you to our partners at the state, the legislature, and Governor Newsom for making this moment possible. And now we're pleased to introduce California Health and Human Services Agency Secretary Kim Johnson.
What a wonderful day, an honor to be here in this moment. Thank you, Baby to Baby, for this partnership. This initiative shows us what's possible when we look to state leadership, community expertise, and shared purpose of coming together. For California Health and Human Services, today's announcement, I just want to say health doesn't start in a doctor's office. It starts at home. It starts with whether families have the essential things they need to care for their children in those first critical days of bonding and connecting with a newborn. And sometimes that simply comes down to something very simple: diapers. For too many families, as you've heard, diapers are just not affordable, and the stress of thinking about how to care for that newborn becomes overwhelming as you're transitioning to this expanded family and experience. It's not a choice that families should have to make. So Golden State Start is more than a diaper program, and as you've heard, the first in the nation public health intervention with diapers. We want to ensure, starting from day one, that families have that healthier beginning, preventing health risks, strengthening family stability, and it certainly builds on some work that the governor and the legislature have done to date. You heard the director reference healthcare affordability and the work we've done with CalRx, the work that we are doing for pregnant individuals across California, bringing community health workers and doulas as a Medi-Cal benefit, the ways in which we are pouring in and transforming behavioral health and mental health supports across California, and especially related to affordability, expanded access to childcare and early learning in TK, and thank you, Mayor Lori, for also leading here in San Francisco on that front. Universal school meals, where now everywhere across our state, parents don't have to worry about the food and getting their children nourished and fed throughout the school day, expanded parental leave, and more. Families, California has your back. We are leading with innovation. We are always rethinking what government can do. Golden Start reflects that same spirit. And again, we're not only addressing an immediate need, we are testing a new model. We are innovating how the state can use its scale, its partnerships, and purchasing power to make essential goods more accessible for all Californians. At its core, Golden State is about something very simple: giving every child in California a strong start, and giving every parent a little more stability, a little more support, and a little more peace of mind during one of life's most important moments. That's what this initiative delivers. And with that, it is my honor to introduce a true champion of California and California's families, Governor Gavin Newsom.
Mr. Mayor, to everybody that's assembled here today, it's an honor to be here. And by the way, honor to hear the Secretary. She reminded, I don't know why, but as she's going on bragging about California, which I appreciated, and highlighting some of the things we've been doing on affordability, I was reminded what Pericles said to the Athenians: we do not imitate, for we are a model to others. It's a point of pride. It's a point of pride being here back in San Francisco, and was our mindset when I had the privilege of representing the city. I know it's Mayor Lurie's mindset that we have a unique responsibility and obligation to lead. Not just identify problems, but begin to solve problems. And the biggest problem defined universally in our city, our state, and our nation is the issue of affordability. This is what affordability looks like. It's not a slogan, it's a box. It's a box of diapers. It's addressing the essential and essential for any new parent, for any new family. And that essential is no longer affordable. Since the pandemic, we've seen the cost of diapers go up 45%. $1,000+ a year cost of diapers. You heard the statistics. 1 out of every 2 people, families cannot afford diapers. You hear the stories over and over again, and they need to be repeated over and over again. 1 out of 4 families skip meals to pay for a diaper. 1 out of 4 skip meals to pay for diapers. I got interested in this space, yes, as a parent. Certainly. Any parent by definition, would. But I was also intrigued by this industry. And forgive me for an aside here. I don't want to go down a deep or dark rabbit hole, but I recall a platform by the name of Diapers.com. And there was an interesting story about how they were taken out by predatory pricing and how there were some platforms that had cornered the market in diapers because, again, it's an essential and they can make a buck. High margin, relatively low costs, and it was all about cornering the market. I'll leave it at that. At peril I offend, but it's worth learning more about the history of that platform and how it was devalued and undercut as it relates to predatory pricing. That's why I was so inspired when I was reading about these two remarkable people you see behind me, Kelly and Nora, and all these exciting things they were doing in Southern California, not just within the region, but in our state, to create a state of mind and a quality imagination about a new pathway and new approach to the issue of affordability and diapers. I had been reading about them, hearing about them, but I didn't have a chance to meet them until, as Nora referenced just a moment ago, Nora and Kelly came up to our office because they were the force behind California's efforts and a bill that I had the privilege of signing to, as they said, cut taxes on the cost of diapers, eliminating the sales tax. And it was wonderful to hear that we were one of the first states to do that and how other states follow. We are not imitating. We're a model to others. That's how the relationship with Baby to Baby started. But then the conversation continued. What more could we be doing? What more should we be doing in this space? It's nice to eliminate the sales tax, but we're not eliminating the overall cost burden. And that's when these conversations started to gel. And that's where the process began to unfold. Assemblywoman Ortega and others in the legislature. And we were able to get an appropriation in a year or so ago, went through a competitive bidding process. And here we are making this announcement. 40 million diapers, as many diapers will be distributed this year as Californians. We'll get to 80 million next year. The goal ultimately is 160 million, but we'll start 25% of the need, get up to 50% of the need next year with the indulgence of the legislature. I've put $12.5 billion into the budget in January that they hopefully will approve to allow us to get to the next phase. Eventually, we'll look to do direct-to-consumer. We'll look at birthing centers. We'll look at other opportunities, not just, as was stated, the hospitals, but thank you to our hospital partners that we'll be announcing shortly. We've already in contact with about 65, 70 or so hospitals that are focused, as was stated, in low-income and high-need communities, high Medi-Cal populations. So we're going to go where the need is greatest first, and we'll start with 400 diapers. Again, gratitude, praise to Baby and our partners in the legislature, and pride for being here today to try to jumpstart a different kind of conversation in this space. I'll just close as the Secretary began. This is part of our parents' agenda in the spirit of Mayor Lurie. You know, and we rolled that out years ago. We had a dream of TK for all. We started with one slot, and here we are fully implementing it 3.5 years later, saving about $17,000, $18,000 a year in terms of costs. We did that. The largest state in the union. It's no longer K to 12. It's pre-K to 12. You can argue pre-K to 14 since we made community college free years and years ago. It's part of the effort with CalRx, which will hopefully be a part of this conversation going forward. Look forward to talking where the next governor is about that opportunity, about not subsidizing costs, but lowering costs, just as we've done with $11 insulin. No one else has done that. They're still talking about subsidizing to get it down to $35 federally. We've undercut that market, gone direct, doing biosimilar insulin, providing it for $11. All in these areas around affordability. First state to do free universal meals, 2 a day. Now focus on ultra-processed food, farm to table, all the prenatal care, all the ACEs work, everything we're doing to focus on 0 to 3. I can go on, but I'm just stating, again, a mindset around doing more so we can be better and we can prepare our next generation. And I'll just close with this. The issue of poverty, and ignorance, and disease, the old vernacular of the 60s, you want to solve them, you got to begin at the beginning. Our interventions come too late. That's why prenatal care is so foundational. That's why 0 to 3, 85% of the brain is fully formed, is so critical. That's why pre-K is so critical, not just quality kindergarten. And so this is all part of that agenda. The stress and anxiety we all felt, yes, even Mayor Lurie, when he got in the back of the car with a brand new baby, in that baby seat, making sure it was all put together correctly. He was driving. Were you driving? I drove home. I'm a little nervous with you behind the wheel. I mean, it's, but that anxiety, the fear, the anxiety, and I don't care who you are, and this financial burden is real. And so this is for all of those that are about to experience that magic. And hopefully we'll distill a sense of well-being and with this initiative for those that are the beneficiary. So with that, we're here to answer any questions, if we could, on this topic first, respecting everyone behind us.
Governor, it was in Mayor's Club.
Yeah, not as many as I could have. That's what my wife, that was her edit. Yeah, I want to get that answer. I want that on the record. This is good.
Governor, he knows my wife. I changed a lot of diapers. I was right there, front and center.
Wow.
I saw it all.
Really?
Yeah. Oh,
you said that very confidently. I'm going to stress test that with Becca, the First Lady. I want to. He's talking a big. That's what I said originally in my memoir, and then my wife. That was her one edit. She said that was not true. Yeah, quite literally, yes.
Thanks very much. All throughout the state, we're focusing on babies born to Medi-Cal moms. Almost half of babies are born to Medi-Cal moms, and so we've pulled the data, and we'll be contacting those. We'll be working with those hospitals for the distribution. No, there are Medi-Cal babies, of course, throughout the state of California, so a lot are in urban areas, and we'll be working with those with the highest numbers.
But it is, I mean, that stat, and we've heard that for years, but half of the babies that are born into Medi-Cal, and about 400,000 babies a year in the state of California. And we'd like to get that number up. We need to do that in this country as well from a demographic perspective. And this is just a small step, but it's one step in that direction to encouraging more families to begin their family formation earlier. More and more people are delaying that for affordability reasons in many cases. So again, this is just an additional step in that direction. Anybody else on this topic? Yeah. You Sutter want to talk? Come on. Yeah.
Hi, everyone. I'm Dr. Allison Wu. I'm the head of the Women's Service Line for Sutter West Bay Medical Group and the OB-GYN director at CPMC. And we're just really excited about this partnership. I think as an obstetrician, diaper insecurity is one that you don't hear about as often on the front lines, but we're excited to partner with Baby to Baby and really just provide these services for our moms. We know that some of these moms that come in, or birthing persons, the cost of gas, the cost of parking, the cost of housing, that's what we talk about, but the cost of diapers we don't talk about as regularly, so we're excited for what's to come. I'm going to invite Dr. Chris Ratajczyk up as well.
Thanks, Allie. So I'm Chris Ratajczyk. I'm the Chief of Neonatology for Sutter Health, and it is a huge problem, diaper insecurity. At Sutter, we're all over Northern California. To your point about geographic regions, there's a lot of rural hospitals that Sutter takes care of, and that we'll be partnering up with this team. I think it's an amazing mission. We are super excited. Diapers are just such a kind of burden for families, and we want to make sure that that is not going to be such a financial burden for them going in the future. So thanks very much for having us here today, and I'll turn this over to Dr.
We have someone who's expecting. And we'd be remiss. We didn't need to hear from any of us. Maybe we should hear from you.
Happy Mother's Day to you.
Yes.
¿Quieres decirlo en español y yo lo traduzco? Sí. Okay.
Hola, muy buenos días a todos los presentes que están en este lugar, aquí al señor gobernador y al alcalde. Mucho gusto en conocerlos. Yo vengo representando aquí a las madres migrantes que somos y yo quiero agradecer por el apoyo aquí del señor gobernador que nos da. Sinceramente, como emigrantes que somos en este país, a veces es muy difícil, pero en este país hemos encontrado la ayuda y no nos hemos sentido solos como emigrantes, y muchas gracias.
She said, thank you so much to the governor, to the mayor, and everyone here today. As an immigrant who came to this country, it's nice to see that we are being taken care of, and I'm very grateful and appreciative for making today happen. ¿Cómo te llamas? Her name is Damari Perez, and how many cuántos meses? 7. And she's 7 months pregnant. Thank you.
Quite the contrary. I'm very proud of our efforts in low-carbon green growth. I'm proud of the innovation. I'm proud of being the dominant force in terms of changing the way we produce and consume energy for this nation. I'm proud of our leadership, and I'm proud of our competitiveness. I think it's one of the biggest mistakes the Trump administration has made vis-a-vis China, giving up the opportunity to compete in the next big global industry. You've seen China flood the zone with electric vehicles, 70% of the supply chains. It's about statecraft. It's about not only flooding the zone with high-quality, inexpensive vehicles, but it's also about locking in supply chains. And it's about statecraft in terms of locking in relationships. And you're seeing now some of the largest automobile manufacturers in the state, not only our state, but across the United States, make the case of how concerned they are about China's dominance in this space. In so many ways, it are policies that allowed them to compete that have been rolled back by the oil companies and rolled back by the Trump administration. As it relates to our efforts, you have seen the issue of transparency front and center in the state of California because of 2 special sessions. It gave us the ability, a window to look into the future. We had a year to look into the future as it relates to what happened with the refineries in Valero. And we had the opportunity, because of that special session, to prepare for that. And we did just that over the course of the last year, last April through the last month. We also, as a consequence of having that window into the future, worked with the legislature to try to balance things out as it relates to Kern County and some changes that we made. So it's about a pragmatic approach. Now, as it relates to the cost of fuels, California hasn't changed anything as it relates to that cost. Those baseline costs have been static. But the cost at the pump has not been, for one reason, Donald Trump's recklessness as it relates to the war in Iran, period, full stop. And what they're trying to do is tell you and everybody else every single day, all these high-paid lobbyists and the folks that are paid by them are telling you somehow it's someone else's fault. It's Donald Trump's fault. We had stable gas prices the last 2 years, consistently. The only thing that changed was what the voters told us they wanted to change years and years ago, and that's the annual CPI as it relates to the fund that pays for our roads and bridges and our infrastructure. Otherwise, everything was status quo ante, despite all the screaming and yelling on the low-carbon fuel standard, despite all that stuff that was being written about all that, didn't materialize. So this is Donald Trump's crisis. It's of his making, and I continue to be very proud of Ronald Reagan, who launched the California Air Resources Board. I'm very proud of Richard Nixon, who created the Clean Air Act, the Endangered Species Act, the Clean Water Act, and afforded California its waiver so that California can continue to lead in 1970 in terms of our efforts to not only grow our economy, but to reduce our greenhouse gas emissions. Well, is Donald Trump promoting that? Why isn't Donald Trump providing a federal gas tax holiday? He's not promoting that. It's interesting that Ron DeSantis, one of his acolytes, is not promoting it in Florida, because he made the point last time they did, it wasn't passed along to the consumer. There's nothing that says you can't pass that along. They pocket the difference. I think that tells you everything you need to know about that proposal, or lack thereof, from the president himself. I'm focused on diapers. Oh, wait, someone wants to introduce themselves. You think this was someone call a friend or something, one of those game shows.
Thank you. Good morning, everybody. My name is Christy. I'm one of the doulas from Bird Companion Community Center. I represent all the doulas right now. So this is a beautiful, because thank you, Governor, and also our mayor and everybody here. Thank you. This is an amazing help for our pregnant mom. Can you believe my organization did 800 births last year, and it's amazing how every mom need a connection with the doulas, and we work together. Oh my God, mental health, all the needs that moms and the pregnant people need, we're gonna be here, to support. So thank you for being here, because it's a huge. I know you were before in San Francisco. This is my first time, and see you in person. So, and thank you. And I want to say thank you, everybody who are here, because you know how important it is be together and making a lot of solutions from a lot of problems in the world. But, the world is like that, We need to be like a balance. Just let's keep it strong, because I know we are here to one purpose, like fight with the right thing, fight with the right from every client, every pregnant mom who is in the hospital right now, waiting for that opportunity to somebody they can support. This is huge. So thank you from my bottom of my heart.
We should all walk away and end right there, obviously. But thank you for that, and thank you for the work you do. And I'm so proud, working with the legislature, we expanded doula access and reimbursements. We, in the spirit of Mother's Day coming up, we significantly expanded paid family leave and paid sick leave. We actually increased in 2025 the reimbursement rate up to 90% in some cases, which is a big deal. Again, that's nation-leading stuff that this state is doing to support moms and the families. Look, I didn't mean to be flippant about the governor's race, but you've heard me on a consistent basis. This is an area of deep consistency. I'm focused on many things, and I appreciate the focus on the race, and it seems to be coming more and more into focus. It's my intention not to get involved in the primary. It's my intention to do everything that needs to be done to make sure that there's not a lockout for a Democratic choice in the general election. That's my focus. I've consistently maintained that over the course of many, many months, and that's where my mind is today as well.
But your endorsement could, in theory, boost the candidate, potentially avoiding that?
Well aware. We've had the same conversation over the course of many months. These are Democratic primaries. There are a lot of people that I've worked with for many, many years. I've made this point again. We can roll back the tape on many different occasions, many different settings. And so that's why. It's just the basis of prior relationships and the respect for, I was there myself. And Governor Brown was sitting here saying, in essence, what I'm saying today. Drove me crazy, I admit, when I was the candidate. I was like, what the heck? And now I need to call Jerry and apologize maybe for my feelings. Maybe if you talk to him, tell him I get it now. And anyone, in 4 years, 8 years, you'll be doing this again to someone else, and they'll probably be saying the same thing.
Mr. Governor, thanks for taking the time and for having us here in San Francisco.
All the way down. Look at you. I'm impressed you made it all the way down.
Thanks, Governor. Now, let's see if we can make some news on another matter here. It might be the last time we get to see you before your updated and final budget presentation. How are you feeling about your...
Good. Optimistic. As I said, we would be in January. But y'all ran with all those headlines for 6 months and 3 months, so I hope you're going to run with different headlines in 6 days. The May revise is coming. I've made the point. The economy of this state is remarkable, resilient, dominant. You saw the Bloomberg piece going back 7.5 years. No economy in the United States of America, no state has outperformed the state of California. No developed nation in the world has outperformed the economy of California in the last 7, almost 8 years. We dominate. And that will be reflected in the May revise.
Any thoughts on the congressional candidates?
Oh boy, that's see, Daniel left right at the right time. Unbelievable. That's good. I used to do that too as mayor. That's so above. I really have. Cannot tell you how. I just haven't focused on that. I think I'm going to see Speaker Pelosi though shortly. Maybe she'll fill me in on an update on the race. We'll be at Larry Mazzola Sr., one of the giants in San Francisco, at his memorial. One of the great labor leaders. I would not be here in many respects if it weren't for Larry and for the plumbers in that Union Hall, which is iconic. Any San Francisco politician knows the terror of walking in there the first time at a candidates forum. And so I'm very proud that a lot of old-time San Franciscans, including myself, I think I'm in that place now, and at least that description will be over there, celebrating a remarkable life of a remarkable labor leader in San Francisco. Anybody else? Well, with that, we thank Kelly and Nora in particular for their inspiration in getting us to this point, Baby to Baby and their board and supporters, to our incredible team and to the incredible frontline workforce, including our remarkable Assemblywoman. Thank you all very much for being out here today.